Hey, it's Gary, the ER nurse. Before we begin this episode of Beyond the Call Light, I wanted to address some important developments related to the topics in the podcast you're about to hear. This episode with Dr. Tracy Tyson, board certified pediatrician, was recorded on Tuesday, December 2nd. 3 days later, on Friday, December 5th, the Advisory Committee of Immunization Practices, or ACIP, that's the panel that advises the Centers for Disease Control and Prevention, or the CDC, voted to end the long-standing recommendation that all newborns receive the first dose of the hepatitis B vaccine at birth. Instead, they proposed limiting the birth dose to infants born to mothers who test positive, leaving the decision for others to individual discussion between parents and doctors, and potentially delaying the vaccine until 2 months old. Dr. Tyson has expressed her thoughts on this recommendation on her social media channels, which she shares at the end of the podcast. Speaking of which, let's get this episode started. This podcast is for educational and entertainment purposes only. The views and opinions shared are mine and my guests alone and don't represent our employers, past, present, or future. Medicine is always evolving and practices may vary. Nothing here should be taken as medical advice. Always follow your own professional judgment and institutional guidelines.
So, what the studies actually show is that the number one thing that parents can do to support their child's emotional health is work on their own. So, if you're planning on having a baby, go to therapy a few times, have your partner go to therapy, talk about how you're going to parent, talk about how you're going to handle difficult situations, because you just don't ever know what's going to happen until it's you. And so I think that's the biggest thing that I would say. If you've already had the baby and your mental health is struggling, get some help. That's the number one thing you can do, because you cannot change your child. They are who they are, and they are going to have their own emotions and experiences and behaviors that have nothing to do with you. But how you respond to it is the kicker. So studies show that parents who have anxiety are more likely to parent with anxiety. And so they are more likely to have children who are anxious. And so I think that's the biggest thing. The other thing that I would say is that it is absolutely not true that you can spoil a baby. So you do what feels right to you. If it feels wrong to not pick up your baby, pick up your baby. I tell parents, I have some parents though that are like, no, I want them on a schedule from day one. I know myself. This is who I am. This is what our family's going to be like. And I say, okay, well, how do we do that safely while supporting your child's emotional and physical needs? And so I think it really depends on the family, the culture. But yeah, we're trying to raise kids that understand their own emotions and can get what they need, and they know what to do with their emotions.
Welcome to the Beyond the Call Light podcast with Gary, the ER nurse, where we tackle the tough topics in nursing. Update your whiteboards and huddle up, because this episode begins now.
Hey everyone, and welcome back to Beyond the Call Light. I'm Gary Cope, your host, and today's guest is Dr. Tracy Tyson, a board-certified pediatrician. I found her TikToks. She does a lot of great educational information, so I reached out to her and asked if she'd be willing to come on the show and answer some of these questions that she gets quite a bit, as well as tackle some of the issues that we're seeing with the CDC in terms of vaccine schedule. So I'd like to start off and just welcome Dr. Tracy Tyson to the show and ask her if she could just give a little background on herself.
Thank you so much for having me. I was absolutely honored. I am a board-certified general pediatrician, as you said. I've been doing this for 21 years now. So I've worked in ICU step-down as well as emergency medicine as a general pediatrician for over 10 years. And then I've been doing primary care for 15 years now. So I mostly see patients in clinic now, where I focus on newborn to age 21. I don't do hospital work anymore, but as of 3 years ago, I was still doing hospital work and C-section call and things like that. So I've had a wide variety of kind of expertise when it comes to pediatrics. I live in New England now, but I originally trained and am from Florida. So I've kind of just recently started over again my career within the last 5 years.
Well, what first drew you to pediatrics, and how has your perspective changed throughout your career?
I was one of the strange people that at a very, very young age, like around 5, would tell people that I was going to be a pediatrician. And I really have never faltered. I've never said anything else. I had a lot of doubt that I would actually be able to get there, because I certainly don't come from a family of doctors or even anyone in the medical field. But it's been always. So since I was a really small child. And I continued to be interested in pediatrics, I think mostly because I was drawn to the kind of people that were also drawn to pediatrics. I loved all aspects of medicine. Actually, my favorite was trauma surgery. I had the best time and I loved surgery. But I just found myself gravitating more to people who worked with kids. And I found I felt more like myself. And I didn't have to maybe pretend to be somebody that I wasn't. I could be exactly who I was. So it kind of just then fit my personality as I kept on in training. And I think the only thing that's changed for me is that I saw it as this, just kind of noble job that, I was just going to, have this great relationship with families and it was all going to be kind of sunshine and roses. And I think that as time goes on, I've kind of recognized that, it's a really challenging field and it's getting more challenging over time. So I definitely had some burnout right around the time of COVID, which a lot of people did. And that burnout that I experienced really changed the way that I saw pediatrics. And now I see it as more of a advocacy type job. Like I see it as that I am an advocate for all children, not just the child that's in front of me and either treating their illness or helping their family. So I do a lot more work when it comes to pediatric advocacy in legislature and, national things like that, which helps ground me a little bit more and makes me feel like I can still continue to make a difference.
Now, before we get into the details of
Mhm.
all the changes that are happening, particularly with regards to vaccines, what would you say are the most common questions or concerns that you get from parents, particularly of newborns, like new parents, in those
Yeah.
early weeks, in the early months?
Yeah. With respect to specifically vaccinations or just in
Well,
general?
like in general, we'll get into the
Yeah.
vaccinations here in a little bit,
Yeah.
but in
Yeah.
general,
Yeah. I mean, what I mostly get in those first few days is just what's normal. Is it normal that they do this? Is it normal that they do that? There's a lot of needing that comparison. Like, how many times should they be going to the bathroom? How should they be sleeping? Should they be making that noise? So I feel like I get that. Is this normal nonstop? And then, of course, I get a lot of questions about breastfeeding, formula feeding. What's the best formula? What is really true? I think I spend a lot of time helping debunk information that they have heard either from their family or friends or online. So I tend to be like a sounding board for, yes, that's true to a certain extent. However, this is really the case.
let's shift now into the vaccines because that's always a major topic with parents, even before this administration has made significant
Mhm.
changes. So, vaccines are obviously one of the most important tools in healthcare, particularly with pediatrics, but it is also one of the most debated. What do you think parents misunderstand most about the recommended immunization schedule?
I think they misunderstand all the way down to exactly how vaccinations work. They misunderstand why we're using them. What is their ultimate goal? Not every vaccination is meant to 100% prevent the infection. Some of them are meant to, delay the onset of the infection. Some of them are meant to control it in a community. Some of them are just meant to take it from wild to mild where you don't have as serious side effects from it. And so I think it's just misunderstanding in general about how they work. And I would also say misunderstanding about something being toxic or not. We hear so much about, well, something is toxic at that level, but oxygen is also toxic at certain levels. So I think
Uh-huh.
it's wording of what they understand as what exactly is in them and how they work. And I think that if you take it back down to those basics, you can just watch the shoulders relax in the room and everybody starts to take a deep breath because they're not used to getting straightforward answers about exactly how things work.
Now, this year we saw some very interesting updates to the CDC child immunization schedule for parents who may not be familiar. What are some of the biggest changes they should know about?
The biggest change that we saw, and there's more coming, sadly, but the biggest change that we saw was changing the schedule for the COVID-19 vaccination. So that was recommended from 6 months and above to every child. They changed those recommendations to 6 months to 2 years for every child, and then 2 years and above with medical decision making. Which sounds like great. That's what we always do. And it is what we always do. However, that wording made it to where it is really hard to get the vaccination. It took us weeks longer, even up here where I am in New England, to get a hold of the vaccination for those kids over 2, and then also degraded a lot more trust around the COVID-19 vaccination. So that was a big change we've seen, and we've already seen even more so plummeting rates of COVID vaccination this year compared to previous. They did remove thimerosal from the flu vaccination. However, thimerosal was only in the multi-dose vial of flu vaccination, which is given, like if you go to a pharmacy and you're an adult, but that's never been given to children. I mean, not any time in the last 10 years since 2001. Thimerosal has not been in any childhood vaccination. So that really didn't change much for us, but it did get people to ask a lot more questions about the flu vaccine. And I think it degraded trust that was already a problem in the flu vaccine as well. There haven't been any other changes yet. The first ACIP meeting they had, they couldn't agree to make any changes, really. They changed the COVID-19 vaccination, and then they took the thimerosal out of the multi-dose flu. But they couldn't change anything else. They knew they didn't have any science to make changes. They are now going back and talking about making even more changes, sadly. So there's another meeting at the end of this week to make even more changes outside of that ACIP meeting, which honestly isn't done very often. That meeting's usually a once a year unless new information comes up.
You talked about they don't have the science to back it up. I don't know. I guess the way I see it is I don't think they care about whether or not they have the science to back it up. As you see with the message that the COVID vaccine that they put out, without proper context, that it resulted in the death of 10 children. And now, it doesn't take a lot of Googling to figure out what is happening here. And those are from various reports that don't have a lot of evidence to back those up. There's a lot of context missing. There's a lot of unanswered question. It's self-reporting. So I guess my question is, does science actually play a role in any of the decisions that we're seeing coming out of the CDC?
We don't think so. I mean, we're not noticing any scientific-based reporting happen, which it has in the past. I mean, I used to look forward to the ACIP meetings because I knew that they were going to go back over all of the data that had come out in the last year, and sometimes even longer. They would go back up to 5 years sometimes, and they would make changes to when we gave vaccinations. So we would hold off on ordering vaccinations till we knew what the ACIP meeting was going to do, and we put a lot of trust in them. They used to ask the American Association of Pediatrics to be a part of it, the American Medical Association. They asked a lot of the, medical providers to be a part of it because true evidence-based medicine, the last part of it is the actual expertise of the people giving the intervention. So you can't make a recommendation if you don't even remotely talk to the people that are giving it. And we are not invited at all. So I don't think there's any science being looked at. And what is being looked at is being cherry picked. And it's being, I think there was one statement made that said, well, we don't have the science yet, but we'll get it. And that's just not how science works. Science asks a question, it throws out a net, and it says, okay, what comes back? And then let's see how we look deeper into it. It doesn't say it's going to find an answer when you've already made it's not even a hypothesis. Like they've made a conclusion without ever going through all of the evidence that you're supposed to. So short answer is no. There's no scientific processes going on.
I didn't think so, but it's always nice to talk to a doctor. Now, when these guidelines change, obviously you touched on the fact that parents have a lot of questions. How do you help parents make sense of what we're seeing, these changes that are coming out?
It's really hard. And I do it a few different ways. I try my best to stay up to date in what they're actually hearing, because I know the actual real scientific evidence that's coming in, but they're hearing things that are all over the place, and they don't want to ask me because they feel embarrassed, or I'm going to, kind of say, oh, that's ridiculous, and not really give them the time and energy that it takes. And so I think, understanding what are they hearing and trying to understand what myths are going on. The second one is to just sitting down and saying, I get it. Like, I understand how you feel. I have given over 37,000 vaccinations. So I am my own study. Like I am bigger than some of the studies that they are now using to say that vaccines are unsafe. And so let me tell you my experience. Let me tell you my real world advice. It helps sometimes to go into the science and give them all the nitty gritty about aluminum and this and that. But mostly they just want to hear that you care. They want to hear that you're a human being who has to go through the same things that they are, and that I lay my head down every single night. And the only thing I worry about is not being able to give them the vaccinations, not the vaccinations I gave them. And I think that that's what they are missing, is feeling like someone cares about them. So I try to put myself in their position and tell them that I follow the vaccine schedule for my own kids. And one of my children had a febrile seizure with the MMR vaccine. And I share that with them. And I share that how I would feel if I wasn't in the medical field. And that happened to me. So I feel like trying your best to be truly empathetic while then giving them as much evidence as you can, I find works the best.
You talked about the COVID vaccine rates have obviously dropped because of the changes. Have you seen vaccine hesitancy outside of the COVID vaccine with other vaccines that we see? Have you seen a greater increase in parents withholding that from their kids?
Yes, dramatically. When I first started private practice 15 years ago, there was a push. That was right when social media was really getting going. And then it seemed to calm down a little bit. And then we all saw it increase with COVID. During the pandemic, we saw vaccine hesitancy in general go up. But what I'm seeing right now, I've never seen anything like this. I
Oh,
am seeing at least one a day that I'm either modifying the schedule, not giving one of them, having to do, a counseling visit that I didn't have time for and running behind because of it, doing a prenatal visit with a family because they want to know how I'm going to handle not giving vaccinations. Um, it's rapidly increased at a faster rate than I expected. I
hmm,
really, because we see it all as, okay, this is not true. They're not following science. Like, when you've got 99%, actually, it's probably 95% of US doctors agree with the vaccine schedule, agree with the science, and vaccinate their own kids. What other field do you have that many people actually agreeing?
right.
I thought that would stand for something more, but it it's not as much as I expected. So sadly, it's really gone up without true informed consent. I just had a family the other day that declined a few interventions at birth and really wouldn't let anyone give them any counseling. Just kind of said, "No, we have all the advice we need." And so I take it to the next level and I say, "Okay, so let me tell you now what you're looking for if your child gets one of these conditions." And when I got done, both parents' eyes were huge and they were like, "We did not understand. If we knew that, we would have never declined these
Hmm,
preventatives at birth." And
wow.
so I think that, and there's not enough time in the day to do this for every single patient. And so sadly, parents are feeling left without true informed consent.
Hmm.
And we're getting a ton of babies not getting the vitamin K shot at birth, a ton of babies not getting hepatitis B at birth. And then all the other vaccines as well are going down.
We'll come back to some of the vaccines maybe later in the show, but I
Mhm.
want to transition over to more of a general pediatric practice. And so let's talk about questions that new parents bring you every day. I have three children. I remember the first child. I felt so clueless. I remember sitting there holding my child in a rocking chair. The nurses and doctors had left. And I just remember feeling, I have no idea what I'm doing. There's no manual, there's no book on this. I mean, they've written lots of books, but it doesn't mean anything to you when you're in that
Mhm.
moment. How do you help these new parents transition to this massive life change?
Sure. Well, there's a few things. One thing I have in my practice, which is a national program, but we have a grant to have it in my specific practice, is a program called Dulce. And it is where a family support person is paired with a doctor or nurse practitioner like myself, and they are embedded into every single visit because so many things that have to do with the questions in the newborn period are logistics, are breastfeeding questions, or I don't have the proper stuff to take care of this baby. So we have a family support person that's involved in every single visit that goes over all those social determinants of health. And I find that that is extremely helpful for families across all socioeconomic levels, across all education backgrounds, because there's always something that you don't have or don't know. So that's one thing that we do. And another thing that I do is I try to anticipate what questions they're going to have. Because as I were saying, you don't even know sometimes what questions you have because you've never done it before. So I have, at least 5 or 6 things each visit where I'm like, okay, this is going to happen next. And this is what you do. Like I've never done a 2-week-old well visit where there wasn't an upset stomach, where there wasn't gas, and a miserable baby where the parents are questioning, are we feeding them right? Like, do we need to change our diet? Do we need to change their diet? What's going on? So if you give them the anticipatory guidance of what they could see, the confidence level goes way up. So I think just knowing what could be coming is important and giving them that guidance before they have a chance to ask. Because I see so much deer in the headlights, but I don't always get the questions I wish that I would. And they're sleep deprived. They're exhausted, they're overwhelmed, and they're getting advice from every way you can possibly imagine. And sometimes they just don't know how to filter it all. So that's a few things that I try to do. And I try really hard to also be just an advocate for the baby first and then the parent second. Sometimes it's saying, I know you're tired. I know you're exhausted, but what we're doing is not safe for the baby. So I'm always going to be their advocate, but then let me tell you how I can help you also. And I think that also puts things in perspective for the parents as well. And then we take a lot more time these days screening for parental mental health. We take a lot more time like talking about the whole family, because if the family is more stable and has the supports that they need, then all of the things going on with the baby are so much better.
You
Mhm.
talked a little bit about anticipatory, like
Mhm.
prepping them for the things they can expect. Let's talk about developmental milestones. That's one of the
Okay.
biggest concerns that parents have. What should they be doing at 2 weeks, at 1 month? What can we look for? So what developmental milestones matter most to you in the first year of life for a baby as a pediatrician?
I think probably the one that matters the most when you look at long term is going to be that social emotional development. And so that's going to be bonding when they're newborns, making eye contact, tracking, letting you know their wants and needs, and then really watching them engage with their caregivers, watching them, being able to let you know what they need. So social emotional is probably the one that if you look at long term data, what is going to be the best indicator for the child's overall development? By 2 months, they should have a really good social smile. They should be tracking you. They should be moving all arms and legs equally. By 4 months, they should be laughing. They should have a primary caregiver. Even if they have a 2-parent household, there should be one person that is their person. That is a really important developmental milestone. By 6 months, I want to see them doing some babbling and making some consonant noises. I want to see them rolling over both ways. I want to see them trying to sit. Not every baby can sit well at 6 months, but at least being in that position. I want to see that they're trying to get your attention. I want to see that they get excited when you walk in the door and that they're getting those new emotions. And then there's a really cool thing that happens at 9 months called object permanence,
Hmm.
where the baby learns that, something like a pen, if you hide it under 9 months, it's gone. It never existed for them to begin with. After 9 months, they go looking for the pen and they will find. And so they start to know when you leave the room. So separation anxiety kicks in, but that's when they start to want to move, like crawl or pull to stand or walk, because they're like, there's something outside of my little world and I want to go get it.
Right.
And that is the one that I like to see the most because that lets me know the baby's brain is pulling, I call it downloading from the internet. Their babies are born kind of like an iPhone with a few apps already on it, and it does a few things, and all babies look very similar till around 9 months. Even with significant delays, they can look really similar. But when they have to communicate and they need to start downloading from the internet, that's when I really start paying attention really carefully, because that's when I'm looking at cognition and social emotional language development, things like that. So it's really fun. I love developmental milestones. The only other thing that I would say is that while they are one of the most important things I do, they are not the whole story. And not every kid develops in the same way, and not every kid follows the same track. Sometimes they'll really improve in their gross motor, and then they're not doing as much fine motor. And then some kiddos are having full sentences with you and they're not walking yet. So it's more about the trend, and it's more about the overall picture of the kid. So I do spend a lot of time also counseling parents with, it's just part of it. It's not the whole thing. And so we have to take a whole picture and then keep monitoring over time.
Quick break from the conversation. If you're enjoying Beyond the Call Light, please don't forget to follow the show wherever you listen. You can find us on Spotify, Apple Podcasts, YouTube, and Amazon Music. Hit that follow or subscribe button so you never miss a new episode. And if you're on Apple or Spotify, a quick rating or review really helps others find the show. Speaking of which, let's get back to it. Feeding, that's another huge stressor for parents. Bottle fed, breastfed, families struggling with that. How do you help them manage that and make those choices?
Yeah. So I am definitely a huge advocate for breastfeeding. There is a lot of scientific evidence that talks about how great it is for baby and mom, and honestly, the other parent. It's also really helpful. And so I'm always an advocate for that, but I'm mostly an advocate for the baby being fed and the family being okay. And so what I try to tell them is, I am your biggest cheerleader for however you feel is the best way to feed your baby. But I'll tell you when we've reached a part that I don't think we should cross anymore. So if your baby's losing too much weight, or there's something going on, I feel like your mental health is not good, there's a problem, I'll let you know. And then I just try to do my best to keep talking to families and just be their cheerleader. If they need to start giving express breast milk, if they need to start giving formula, even if it's once a day, because one caregiver really wants to be able to feed the baby. Like, we can make a healthy family look like anything that we want. And so while the evidence is there for breastfeeding, I really try to be like, there's so much more that goes to it than that.
Mm-hmm.
So my job is to make sure that every aspect is looked at. So I have formula fed babies, breastfed babies, express breast milk. I have, mixed. I do a lot of work helping families give bottle and breast. And I really enjoy that, because we can continue all the good aspects while also being realistic about how hard it is to breastfeed.
Now, you talked about weight loss. Obviously, that's a red flag. What are some other red flags that you are concerned about and that you advise your new parents to look out for?
Sure. So when it's related to feeding, obviously significant increase in jaundice in the first week of life is going to be concerning, because babies are dehydrated when they're not getting enough when they're breastfed. So we watch for worsening jaundice, and we also watch for something called milk protein allergy, where babies have blood in their stool, rashes, they're really fussy, they don't grow very well. Significant reflux or gastroesophageal reflux disease can be made worse by certain ways of feeding. And so that's something that we look out for. And then also, maternal mental health. There's actually conditions of significant mental health concerns just from breastfeeding itself. And women don't always know to tell you that this is happening. Because especially if it's a first-time mom, she doesn't know that this is normal or not normal. And so I try to gauge her reaction when she's feeding the baby. If she's tensing and she's upset and you can see it all over her face, I'm like, that's not good for anyone. So I try to help, but then I also try to screen for how detrimental could that be.
How often should new parents bring their newborn babies to the pediatrician in the first year? Like, do you have a set schedule?
To a certain extent, yes. So in that newborn period, we usually do one visit after they've been discharged home from the hospital. And so that's where we kind of get all of the history, what's going on, get to know the family, and we look at risk factors. And then say everything's going fantastic and there is no jaundice and there's no breastfeeding issue. Then we do 2 weeks, 1 month, 2 months, 4 months, 6 months, 9 months, and a year. So
Right.
those are those standard well visits. And then obviously in the newborn period, we might be seeing them more often if they're more jaundice or there's feeding issues or, colic symptoms, reflux. We might see them as often as they need to. So those are our typical well baby visits. There are some offices that don't do the 1 month. And that is just because they don't maybe have enough time. I treat a pretty high risk patient population, and I find that 1 month visit makes a big difference. And so we keep that one, and it is standard of care, but not every office offers that. So I always like to offer the caveat if someone says, well, my pediatrician doesn't offer a 1 month, that one is the one that sometimes you can give up if need be.
Moving from feeding to sleeping. Safe sleep is obviously a big topic,
Mhm.
controversial in some respects. How do you approach these conversations, particularly when it comes to sudden infant death syndrome and the best safe practices that we can have for sleeping children?
Sure. So we know how to keep babies safe and sleep. I think that's the first thing is we have so much evidence. And since we started safe sleep campaigns in the late 1990s, we have seen an 80% reduction in sudden infant death in the United States. So we have the data to back up our safe sleep. Babies should be on their backs on a flat surface, a flat, hard, like a firm surface, and not in the sleeping place with a parent. We know for a fact that's how they should be. They shouldn't be propped up. They shouldn't be in a car seat. Like nothing should be around them. They should be swaddled under 4 months of age and not swaddled after that. They need to be in the room with the parent for the first 6 months if possible. And that's just looking at community data where our baby is safest when you look at how all different our families are with what kind of homes are we in, what's our ventilation, all those things. Babies are safer in the room with you for the first 6 months. So I always tell them the guidelines. And then I say, okay, but I also want to let you know I know how hard this is and I know how tired you are. And I know that you don't want your baby to cry and that is so distressing for you. So let me talk to you about the realities of this and how can we best support you. So I always let them know that I'm worried if they don't have safe sleep practices, but I also try to support them in a non-judgmental way because I also get how hard it is. And I know that it's not that simple. And parents are doing the best they can every single day. And I also want them to continue to tell me the truth. And if I'm too rigid and say, this is the only way to do it, this is all, then they're not going to tell me anymore. And then I can't be there to help.
Right.
So, I try and we do it every time, but so often families are like, well, this is just what we're going to do. And I'm like, all right, well, let's do that the safest that we can do it. Right. So
Mhm.
if they're definitely going to co-sleep, then I'm like, okay, let me give you some tips to co-sleep as safely as you can. And then that at least gives them an extra layer of protection.
Okay. So you can acknowledge that this is the path they have chosen, but you're still working with them on that and,
Oh,
and,
yeah,
and to,
absolutely.
to keep the baby as safe as possible.
Yes.
Okay. You talked about some of the challenges that parents face. Let's talk about colicky babies.
Mhm.
It is not super common, at least in my experience, but we have a neighbor down the street who had a colicky baby,
Mhm.
and
Yeah.
you just felt awful. And my wife would say, if you need me to come sit while you take a walk, like, let me
Mhm.
know. But can you kind of address that? Have they figured out any causes of this?
Sure. Colic in general is kind of a diagnosis of exclusion. And so the best we understand, which there really is less data than you think that there is, but colicky babies are babies who there isn't another cause of it. So it's not a refluxy baby. It's not a baby with constipation or formula or milk intolerance. It's really where we don't have any other cause. They cry for more than 3 hours a day, for more than 3 days a week, for more than 3 weeks without there being a cause.
Mm,
There's a lot of evidence that it's probably underpopulation in the gut associated with, like, there's not enough bacteria in the gut. But then when they did some studies to try to give them extra probiotics, it really didn't make much of a difference. There were some studies that showed C-section might increase the risk of it, but then when they looked at it in other parts of the world, it didn't. So there's definitely some aspect to it that's probably gut related, because a lot of parents are like, I swear to goodness, their stomach hurts. I really think that it does. But there's also a neurological aspect, because it's almost always the evening period too. And we call it the witching hour for a reason. And every baby does this a little bit, right? But when it becomes an extreme is when we call it colic. They used to say things like this was, anxiety in babies and moms, and that's pretty much been debunked. And that really just puts a lot more blame on parents, which I think is not needed or helpful.
Mhm.
And so there's not a lot of great things that you can do, except that understand that it is not anything that you're doing wrong, and that it is going to get better. My nephew was one of the most colicky babies I've ever seen in my
Oh,
life, and that
no.
was the most happiest, well-adjusted child. And it was just a bad few months. And so I
Mhm.
try to put it in perspective and say, this is hard, but this is going to get better, and you are not doing anything wrong. What's your support system? What do you do? There are some soothing techniques that I talk about called the 5 S's, and this has been around for forever.
Uh-huh.
But it was a book called The Happiest Baby on the Block. And it's been one of those things that I still think works, because it just gives you some stepwise things of what to do. Babies need to suck. Babies like movement. They don't like to be still.
Mhm.
They don't want it too quiet. So, kind of shushing and swaying and giving them pacifiers and just doing all of those things to try to soothe and calm them just gives parents some kind of recipe for like, what, just give me something to do. And then I tell them, tap out, say, I can't do it. And a crying baby is a breathing baby. Put the baby down for a minute. They're going to be fine. I promise. Take a shower, call a friend, get a drink, take a step outside. There is definitely some evidence that colic has an increased risk for child abuse as well.
Sure.
And so I always try really hard to let parents know that they need to protect themselves, because they're humans too.
Mhm.
And you're talking about sleep deprived, your hormones are all over the place if you're the birthing parent, and then you've got this colicky baby, and you need to let us know what's going on and let us try to help.
Now, for colicky babies, like you said, it's okay to set them down, breathe, like crying is breathing. Now, let's talk about normal kids that are not going through the colic, they're going through their normal progression. There's this, and we talked about this back and forth in a comment
Hmm.
section on a post about
Hmm.
it's a different generation, in terms of emotional support for the children. I grew up and you let them cry it out, don't pick them up.
Hmm.
And we didn't do that with our kids. And our
Hmm.
kids turned out better than I did.
Yeah, yeah,
you
yeah.
know so talk about beyond the physical health, what can parents do to support the social and emotional cognitive development during that first year, and is it
Great.
okay to pick them up every time they cry?
Yeah, great question. So, what the studies actually show is that the number one thing that parents can do to support their child's emotional health is work on their own. So, if you're planning on having a baby, go to therapy a few times, have your partner go to therapy, talk about how you're going to parent, talk about how you're going to handle difficult situations, because you just don't ever know what's going to happen until it's you. And so I think that's the biggest thing that I would say. If you've already had the baby and your mental health is struggling, get some help. Like, that's the number one thing you can do, because you cannot change your child. They are who they are, and they are going to have their own emotions and experiences and behaviors that have nothing to do with you. But how you respond to it is the kicker. So studies show that parents who have anxiety are more likely to parent with anxiety. And so they are more likely to have children who are anxious. And so I think that's the biggest thing. The other thing that I would say is that it is absolutely not true that you can spoil a baby. So you do what feels right to you. If if it feels wrong to not pick up your baby, pick up your baby. Like, I tell parents, I have some parents though that are like, no, I want them on a schedule from day one. I know myself. This is who I am. This is what our family's going to be like. And I say, okay, well, how do we do that safely while supporting your child's emotional and physical needs? And so I think it really depends on the family, the culture. But yeah, we're trying to raise kids that understand their own emotions and can get what they need, and they know what to do with their emotions. And so I kind of feel like attend to their needs and keep boundaries with them. So maybe my boundary is I'm not going to hold you while you sleep because that's dangerous. So that's a boundary that I'm going to put up with you. But any other time, I'm not going to make you work this out. Like, I'm going to be there for you and help you get through it. So I always say, like, give that nurturing, but with a boundary. And then every baby is different.
And we're kind of focusing more on like these on the baby, but you're a pediatrician. You deal with this all the way up until they're, I mean, in some cases, pediatricians will see them until they're 20, 21.
Yeah.
But I think one of the things that I've touched on multiple times in whether it's a social media post is when I was a kid, and again, it's not that I didn't have bad parents. My parents were good parents. I have a very privileged upbringing. I was very fortunate, but how we handled emotional health was very different in the 70s and 80s than it is now. I found myself with my first one doing the same thing my parents did. And
Mhm.
I did better than they did, but I didn't do as good as I should have done. With our younger ones, I've really changed. And a lot of that's through reading and listening to pediatricians and psychiatrists who deal with kids and emotional health. And I realized, like you said, you need to work on yourself. I realized I have emotional health issues, and that probably stems from my upbringing. I have learned to forget about the little things. They spill something, it's not a big deal. Don't worry about it. They're always looking at me like, is dad going to get mad? And that's how I looked at my parents, terrified.
Mhm.
And now
Mhm.
my kids just go, oops, sorry, I'll clean it up. Hey, that's all I ask. Thanks. Don't worry about it. It's a cup of water, it's milk, whatever, we can clean it. And so when we talk about emotional health development, what about those later years when the kids start to talk and go to school? How do you help parents navigate those challenging emotional times for kids?
Sure. That's probably one of the favorite things that I do. I enjoy it the most is talking about ways to help establish really good emotional boundaries with kids. I think the first thing I would say is that discipline and punishment are very different. Punishment is really rarely needed with kids. All the studies show that punishment can be natural consequences. It doesn't have to be this major thing of every single thing they have. And then I also say, like, we're not trying to raise compliant children. We're trying to raise emotionally intelligent children.
Right.
We're trying to raise good human beings. We're trying to raise good stewards of their community. We're not trying to raise compliance. And so if all you're getting is compliance, you need to change your thought process. And
Yeah.
so again, as I said before, you're not in charge of your kids' emotions. They are in charge of their emotions and they're in charge of their behavior. So if your kid is having a big feeling, express it. Say, you're having a big feeling. You're feeling this. Let me know when you're ready to put your shoes on because that's what the boundary is. You can't go outside in the snow until you have your shoes on. You can feel about it however you want to, and I can handle it, but you cannot do this until. So I think it's a lot of recognizing that the emotions are normal. And then the next thing I would say is sitting with your kids during negative emotions. They really need to know that we can handle their negative emotions and allowing them to feel these big feelings and not trying to fix them. Sometimes we do two things. The first one is we said, I'll give you something to cry about, right? Like, what are you crying about? Well, talk to them about what they're crying about. Try to let them express their emotions. The second thing is that then we went the opposite way where we tried to fix every emotion. Let me fix that for you. I'll talk to your teacher for you. I'll take this to school for you. I'll do this. I'll do that. And then we have this generation of kiddos that knows what they're feeling, but they take no responsibility for it
Right.
whatsoever. They want someone else to fix it. So the current thought process is to try to blend those two where they understand how they're feeling. They know who they are. They know how to sit with negative emotion, but they also understand what to do with it. So that's the resilience piece that I think was missing in between the last two generations. So that's what we're working on with kids is let them fail, let them fall, and let them know that you are there for them and that you can handle it. And a lot of what I tell parents is good strong emotional health comes from structure. And so if your kid is struggling, take it back to the basics and think, what is our structure? What is our bedtime? What is our dinner time? Are we sitting together? Do we have a structure to the day? Because kids thrive on that. Then you'll start to notice where the issues are, and then you can address a specific issue. But they need to sleep in the same place every night. They need to have family dinners. They need to know what's coming because then they can handle all the other stuff.
Hey, it's Gary, the ER nurse and host of the Beyond the Call Light podcast. Are you a brand, organization, or service looking to reach nurses, EMTs, and frontline clinicians who actually care about what they use and recommend in the field and in the hospital? Then we'd love to partner with you on Beyond the Call Light. We're currently welcoming a small number of founding sponsors, partners who want to support education, storytelling, and advocacy within the nursing and EMS community while getting in front of an audience that trusts this show. As a founding sponsor, you'll receive priority ad placement in upcoming episodes, featured placement on our website and social channels, early access to new series and collaboration opportunities, and special founding sponsor status that stays with your brand as the show grows. If you'd like to sponsor an episode or even a full series, reach out to me, Gary, the ER nurse, at gmail.com. Let's work together to elevate healthcare voices and connect your brand with the people who make it all happen. And now, back to the show. Our oldest boy is 10 and he is type A. Like, he wants to do everything right, perfect first time. And if he doesn't, sometimes that can lead to this meltdown where he's not good enough for anything. And as a child, if I did that, that would be met with a lot of resistance and intolerance. Don't do that. We don't do that here. Suck it up. Move on. I've taken the approach of, there was one incident about a month ago where he was totally melting down. And if I had done that with him, it would have lasted so much longer, because now I'm confronting him with anxiety and aggravation, and that's compounding the situation and the emotions he's having. So instead, I just came down and gave him a hug and said, let it out. And in 15 minutes, he was right as rain. Now, that's not every kid. Not everybody's going to do that. But I guess what I'm saying is, try it. If your kid has big emotions, let him have them and just be there to give him a hug and talk it out and see if that helps.
It is such an important point, and I say that to people every single day. If you let the emotion happen, the behavior will get better in half the time. Stop trying to control the emotion and just let it happen. And the same thing goes, like, we have a lot of big emotions in the morning going to school, right?
Oh,
And parents are often telling me about that. And I'm like, okay, you get up early, have everything ready, allow 30 minutes for a meltdown. Just allow it to happen. You're going to be less stressed, which is going to be less stressful for the kid. And then every single time they come back and they say that the stress went down because they allowed time for it. The kid felt heard and seen. The anxiety went down.
and that lends to better overall emotional development as they get older. They understand how to process those emotions and how to get through it better. So I think that's, if it's not something people are doing, they need to change their ways.
Agree.
So you've been at this for 21 years. You've watched a lot change. Medicine is always evolving. Science is always coming out, new research, how we do things, how we approach things. How have parents' concerns shifted over the last 2 decades?
Oh, great question. I think their concerns have switched from illness to the world around them. So I think it used to be very child-centered. It used to be very like, if they were sick, what was wrong? It used to be very much about acute illness. There wasn't a lot of concerns related to development or long-term health. There was a lot more of just in-the-moment questions. So you didn't see kids for well visits very often, even when I first started practicing. It just wasn't a thing. One of the reasons they linked childhood vaccinations with well visits is to get kids in the door, because parents didn't see a lot of validity in it. And so I see the prevention really getting going more so now, as well as I'm more of a therapist now than I was 20 years ago. I really was like, this is an ear infection, this is a sinus infection, this is pneumonia. And whereas now I don't diagnose a lot of medical conditions anymore. I'm doing a lot of social emotional type things, which is a complete shift. I mean, most of the things I'm reading about have to do with parenting and psychology and anxiety, and I'm doing a lot less reading about actual diseases, which is interesting.
Is there a particular case, obviously HIPAA compliant, where a parent's concerns led to a meaningful conversation that you still think back to and refer to today?
I can think of one specifically. I had a family who really didn't see a lot of validity in modern medicine. The kids were homeschooled. They didn't, go to the doctor very often. And all of a sudden they needed a sports physical for like going out of town or something. And the mom came in and she was just kind of like, a little frustrated that she had to be there, understandably. It wasn't something that she really grew up doing. It wasn't something she did with her kids. And we kind of sat down and started talking. And we actually found a massive, massive issue with the thyroid in one of her kids.
Wow.
And she didn't know because she had been seeing the kid every single day and didn't really notice that this was happening. And it
Sure.
actually led to some pretty scary medical things that happened, yet was all fine because we caught it. We were able to treat it. The kid got treatment. And she was actually someone who then started speaking to homeschool groups about the importance of wellness care and how much it changed her perspective. And I think about that all the time. And I think about them. They're all probably adults now. And how much I hope that changed even the children themselves, perspective on how their doctor or provider should listen to them, how they should treat them, make them feel comfortable, and also how important it is to go in even if you don't notice that anything is wrong. So especially in light of things that are going on today, I think that's probably the one that stands out to me as the biggest change I might have made with that.
Now, you talked about you do a lot more counseling than you do diagnosing these days, but how do you stay up to date with new guidelines, emerging pediatric research, those kind of
Sure.
issues?
I read a lot. Right now, one of the things I'm using the most is an app called Open Evidence, which is an AI generated app where you have to have an NPI number to be able to use it, which is a national provider number. Nurses, therapists, medical providers, APPs, we can all use it. And you can get the most up to date and curated articles that are out there and practice guidelines. So you can type in a clinical question like pertussis, right? Because I'm having to look up a lot about pertussis right now. I can type in a question and it will pull up the most recent clinical guidelines and then give me all the articles that are the most up to date, as well as what is the most appropriate for that. And so that gives me something very quick to do in the moment when I have a topic that I think about. Other things that I do, and I think last time I checked, I had logged like over 200 hours on that just since I started using it a few months ago, because it makes me want to read more. It makes me want to go looking for it. And there's not a firewall. A lot of times, you go to look up something on NCBI, which is like one of our search engines it's like the PubMed. And there'll be a firewall and you can't get into it. And you've got to pay for the journal to be able to read it. And so you just don't, because you can't do that every single time. So this kind of gets through the firewall. So if you're not using it and you're a medical provider, it's fantastic. So that's one thing I love to do. And then I work closely with my American Association of Pediatrics. And so I get the Pediatrics Journal delivered. I do it email now. I try to go do some CME, or continuing medical education. And then I work with our medical society. Anything that they send my way by email and things like that, I'll go ahead and do a lot of any online modules. And then we also, for our board certification, we have something called maintenance of certification, where we have to have 40 hours of CME every year, but then we have to do these questions every single quarter. And it sends you like 15 questions, clinical questions, that you have to reach a certain pass rate in order to kind of keep your board certification.
Oh,
So
wow.
we really do a lot more than I think people online give us credit for. It's constant. And then you just listen to each other. And sure, I miss the ER sometimes because you're hearing other cases of what's going on. And you learn just from listening to what other people are doing. And that's another way that I think we all keep up to date, is we listen to our colleagues.
So, as we wrap up, I'm going to ask you a series of questions looking for kind of short answers. If you could give new parents one piece of advice that would make the biggest difference, in your opinion, during their baby's first year, what would it be?
Don't look everything up online. Yeah. Ask your pediatrician.
We're also living in a world of information overload. And in the medical field, we have what we call cognitive offloading. We have apps that can handle some of the calculations. But what is the best way for parents to tell the difference between reliable medical advice and misinformation?
I think looking at the source, find a few sources only that you feel that you can trust. Us as your medical providers can tell you which one those are. If it doesn't come from them, kind of take it with a grain of salt. That's one thing. Try not to look at too many sources.
Mhm.
Google is not your friend. Google is going to show you what's popular, not what's true. So to be really careful with Google itself. Another thing is if there is a trigger word, if there is a rage bait, if there's something on there that promises you something is going to be cured or get better, it's usually misinformation, sadly, because real science doesn't really offer cures or quick fixes. It's usually just information that's multifactorial. And so I think those are big things that I would look for. And who is giving you the information? There's a reason I start all my videos with I'm a board certified general pediatrician. It's annoying and I know it, but I'm saying that because I want you to know who you're getting your information from, because I have literally 27,000 hours of training plus all of these years. And so it does matter who's giving you the information. So what is their criteria? And I also don't talk about things I'm not an expert in. If I'm not an expert, I'm not going to talk about it. So if your cardiologist is giving you information about autism, that's a red flag. They shouldn't be. That's not their field. So that's a red flag right away.
So looking forward, what upcoming changes in pediatric care or vaccinations are you most excited about?
Oh, great question. I am most excited about the idea that as bad as things are right now in medicine, that we have the potential to change how medicine is delivered in this country. So I think that we're at this precipice where I don't know how much worse things can get. I think we can all feel that way. And I really think this is the time it's going to get better. I think it has to get to this point where none of us are happy with what's going on. So I'm hearing some buzzing going on about really just kind of starting over with primary care. And to me, that is really exciting that we could possibly change how we deliver healthcare. Because I think one of the reasons things are so bad right now is because all of us agree that the system doesn't serve any of us. So I think that's what I'm most excited about. And then honestly, I'm really excited about social media. I would not have told you this 4 months ago, but I think social media, if we take this opportunity as experts and get as much expert advice out there and information as we can turn some of this around. So I am more passionate than ever and more excited than ever to offer more education through social media.
I think one of the things I appreciate about your post is that you often include your sources. So it's not only can I listen to what you have to say, but I can go verify those and look at your sources where you're pulling that information. And a lot of people don't do that. And I appreciate that for your social media posts. Now, what do you wish every parent who you see understood about working with you as a pediatrician or some other pediatrician as a team?
That we really are a team. We are not there to judge your parenting or what you're doing. We really are some of the least judgmental people, pediatricians, because there's so many different ways to do that, and we know that. So I think just letting us in on what's really going on and asking us the hard questions. So I really wish that there was more of a back and forth than there is. Like, ask me the hard questions. Come to me with your hard stuff. Tell me when you don't like what I've said or how I've handled something, so that that relationship stays really open and mutually beneficial. I think that's probably the most important thing.
And finally, parenthood, speaking from experience, and I'm sure you can too, can be very overwhelming at times, especially in those early months. What words of encouragement would you offer for new parents who might be listening right now?
Oh, that's a good one. I think if you're doing anything to try to be a better parent, you're already a better parent than you realize. And there is no right way to do this. It is constantly trying and constantly learning and constantly taking one step forward. And none of us finish this journey and think we did a great job. We're just trying our best. But I've never had a parent ask me, am I doing a good job? And they weren't. So if you're trying and you're listening, you're already so much more of a better parent than you realize.
Dr. Tracy Tyson, thank you again for sharing your time, your expertise, and your insights with us today. And thank our listeners for tuning in. Dr. Tracy, is there a way people can find you on social media?
Yes. So I am on TikTok as well as Instagram and Facebook. On TikTok, I'm Dr. Tracy. It's Vermont, VT, not Virginia Tech. And then just Dr. Tracy Tyson on Instagram and Facebook. So come follow me there.
As a Hokie alum, I would not have been at all disappointed if it was VT, but I understand. Thank you all for tuning in today. If you found today's episode helpful, please make sure to like, follow, subscribe to the show, and leave a comment. This is Beyond the Call Light. I'm Gary Cope, your host, and we will see you on the next episode.
Thanks for listening to Beyond the Call Light with Gary Cope. Don't forget to clock out.
Seriously, you guys, somebody go get Gary. The ER is like totally melting down. In the middle of the night, the alarms sing loud. Gary hits the floor and he's drawing a crowd. Blood pressure spiking, someone's on the floor. He slides in like so. Y'all need a nurse some more? Scrub pants sagging, stethoscope on blast. Putt test mic ready, he's about to broadcast. TikTok fame, YouTube game, he's the ER king. Board certified, trouble with the ding ding ding. Pager buzzing wildly. Code 3 Gary snaps on gloves like time to save somebody. Cartman in the corner yelling authority, but Gary's dropping knives like it's easy peasy. Paging Gary in the ER, watch that call light glow. He's got jokes, he's got stories on his frontline show. Trauma based, vascular days, hero and scrubs tonight with the South Park flair and a laugh. Paging Gary in the ER, he's your man, he's your guy. If your vitals dip or your nurse is fried, beyond the call light, he's teaching with style. Paging Gary in the ER, sit back and laugh a while. He's got a TikTok dance when the code's a joke, and a YouTube short when the ivy pokes, no joke. Talking central lines with the vascular guy, dropping pearls like flush it first or say goodbye. Charts and memes, yeah, he's running the beat, while Cartman's whining from a hospital sheet. Chaos to comedy, he's got that finesse, turning trauma into lessons, oh yes, yes, yes. Crash cart missing, whole room insane. Gary strolls in cool like, bro, I'm trained. Wit like Cartman, heart like Stan, but still the nurse you want if the world hits the fan. Paging Gary in the ER, watch that call light glow. He's got jokes, he's got stories on his frontline show. Trauma based, vascular days, hero and scrubs tonight with a South Park flair and a laugh. Paging Gary in the ER, he's your man, he's your guy. If your vitals dip or your nurse is fried, beyond the call light, he's teaching with style. Paging Gary in the ER, sit back and laugh a while. Cartman screams, respect my nurse tour. Gary side, dude, please shut the door. Kenny gets launched across the bay. Oh my god, he's dead. Just another day. Gary revives him with a shrug and a guide, dropping textbook wisdom with comedic pride. Shift from hell, he'll get you through with a stethoscope, sarcasm, and caffeine too. Paging Gary in the ER.